This study is about how parents' diets change as they have children. And what we did was we looked at data from the Coronary Artery Risk Development in Young Adults study, which is a study where they were followed young black and white adults over time to look at coronary artery risk factors, and they also looked at their diets. And so we started, there were 2,563 adults at baseline who didn't have any children. And so we had detailed diet data on them at baseline, and then 7 years later we looked at their diet again and we compared those who had children in the home at that point and those who did not. And what we found was that the good news is that parents' diets didn't get terribly worse, as some people might have predicted, but they weren't any better than their childless colleagues either. The childless adults did slightly better, actually, in decreasing their saturated fat. They were able to decrease their saturated fat by about 2.1%, where the parents only decreased their saturated fat by 1.59%. But it was good that both of them were able to do some of that. There were no differences when we looked at fruits and vegetables, when we looked at sugar-sweetened beverages, which would have been your regular sodas or your fruit drinks, not fruit juice. There was no difference also when we looked at fast food intake over a month. And in terms of calories, we saw that parents did eat slightly more calories, about 79 calories, but that was not what we call statistically significant, which means we can't rule out that that finding wasn't just chance. This study was unique in that it followed people over time. The previous studies that exist were all cross-sectional studies, which means they looked at one point in time. They looked at parents and non-parents and what they were eating at that same time. This one was able to look at parents before they actually had the kids and then look at them again afterwards. So that made it a stronger study design than previous studies. The other unique thing about this study is that we also looked at fathers, so we weren't just looking at mothers, which most studies have looked at. So there were some things that we were surprised about and some things that we were not surprised about regarding this study. Regarding the saturated fat difference, that was something that we had seen in the one-time studies as well, that parents were eating more saturated fat than non-parents. So the fact that they weren't able to decrease their saturated fat as much as the non-parents was not surprising to us. And you think about parents and their need to use convenience foods because of time and financial pressures, and those foods tend to be higher in saturated fat. So it makes sense that parents might have more trouble decreasing their saturated fat than non-parents. In terms of fruits and vegetables, there were some studies out there that had suggested that parents wanted to increase their fruits and vegetable intake as a role models for their kids. But when we looked at our data, we didn't see that. They were able to increase their fruits and vegetables a small amount, as did the non-parents, but they didn't do any better than the non-parents. One thing that we thought we would find is we thought that parents might eat more fast food, might increase their fast food intake more than non-parents. And actually in this study we didn't see that. Now there are a couple possible reasons for that. One is that this data is a little on the older side, so there are more fast food restaurants around now than there were back then. There were plenty, but there are a lot more now. So that may be different for very recent parents. The other thing is that it may be that older parents with older children are more drawn to fast food establishments than parents of younger children, and most of the parents in this study had children under 7. The other thing is that instead of going out to a fast food restaurant, which is how the question asked them, it may be that parents are just bringing convenience food into the home instead of going out to get convenience foods. And so that wouldn't have been captured in that question. So if we had asked specifically about them bringing convenience foods into the home, we might have seen a different, more difference. This data is consistent with the limited data that's out there. There's actually not as much out there as you might think, comparing parents and non-parents. As I said before, the cross-sectional studies that have been done in the United States also showed a difference in saturated fat intake. Now there have been some studies in Denmark and Finland where they actually showed that some mothers did better. They decreased their saturated fat intake compared to non-parents. But Denmark and Finland are different than the United States in that there are, for one thing, a lot of supports for parents when they first have children. They can get up to 11 months of paid parental leave, which is not available in the United States. So there are some cultural and support differences that might play into that, and it'd be important for us to understand that. In terms of other studies, as I was talking about before, there, our work is pretty consistent in, though we had thought we might see some increased fruits and vegetables more than we did. The broader implications is that we really need to find ways to support parents in this what we call a teachable moment to make changes. We think about it as a teachable moment because this is a time when their lives are changing anyway because of children, and they may be motivated to make changes, and we hear in some of the studies that they want to make changes for their children. They want to be good role models. So this is a teachable moment where we can help them make changes. And this study suggests that we're not quite there in helping them do that we need to find ways to support our parents, whether it's through education, other supports, convenient foods that are actually healthier. We need to figure out what are the best ways to support our parents so that they improve their diets as they have children for their health and for the health of their children.